you and I've talked about this, right? The third shot for immunocompromised is different than a booster shot for what would be quote unquote a normal, healthy individual. Can you explain how, in that case, how a booster for a normal, healthy individual works, as opposed to the third shot, which we know is helping them get the full response that they should have gotten from 2 shots, kind of thing? Explain the booster part for the healthy person.
So for most shots, there is a booster shot. So when you get the measles vaccine, and then a while later you get a booster shot. You get hepatitis B, you get 2 shots a month or 2 apart, and then you get 6 months later, you get a booster. So what happens is after you get the initial series of 1 or 2 shots, is your immunity gradually wanes a bit. And what the booster does is it boosts your immune memory, and it usually boosts it way up. So it goes up much higher than it was originally, and then it stays up there very often for months, if not sometimes years. Now, we don't know if that will happen with the COVID vaccine booster, but what we do know from data from Israel and some other places is that the booster is working well, particularly for people who are at high risk for hospitalization due to COVID, like people who are 60 and older. The booster is working very well, particularly say in Israel, to boost up their immunity. And it's maintained it so far the last 2 or 3 months, and is keeping them out of the hospital and keeping them from getting COVID. So it seems like the right time to start looking at boosters. Now, the data we have is only on Pfizer right now. So we expect that the FDA will make a statement sometime today, tomorrow, sometime very soon. The CDC is going to meet tomorrow and Thursday on this issue. So of course, we don't really know quite what they're going to say. They may be issuing it right now, but the FDA, the FDA and CDC's advice on boosters this week will likely just apply to the Pfizer vaccine, because that's where the data is coming from. But boosting the booster shots literally boost your immunity, and they boost your immune memory. So you've built up the immune response with the initial 1 or 2 doses of vaccine, and then the booster shot is given usually months later, and it triggers the memory from your immune system, and it boosts up the immunity, but it also usually stays up there. The immunity usually stays up there pretty high. And that's why, so for instance, for measles vaccine, you get 2 doses and you normally don't need one the rest of your life. Same thing with hepatitis B, you get the initial series, you get a booster shot, you don't need one the rest of your life, generally speaking. So we don't know if that'll be the case with COVID, and it may not be the case at all, because like with influenza, we need different vaccines every year, but I am optimistic that the booster shot will boost our immunity pretty significantly, and hopefully will stay up there, keep the immunity up there for a while. So that was a lot of babbling.
No, it was helpful, and so pardon me for being maybe a little too nitty gritty on the medical side.
No.
Why is it that you space out these the first series of shots, and I'm talking generally speaking, right, about like we talked about with measles or hep B? Why is it that you have that initial series, and then a couple months later you get the booster? Why is it that it goes so high and stays so high? How does that happen?
So the initial series of vaccines that do require a booster, those initial series normally build your immune system. So you're building the B cells and the T cells, you're building the response, right, to the virus. And then months later, what you're doing is you're triggering the immune system's memory system. So, and then that, it turns out that ends up being a fairly large response in most vaccines. That booster shot tends to trigger a fairly large response, and one that stays up there in terms of the immune response. So I'm not saying that too well. So generally speaking, so the initial shots generally help your immune system build a response to the virus. So it's putting in the building blocks, right? And then, so it's building the foundation. And then months later, when you re-trigger the immune system by a booster shot, that foundation's already built, and suddenly it's able to kind of build a building, right? So it suddenly boosts things up. And usually these booster shots often result in a much higher level of immunity and one that lasts longer. Now, we don't know if that will happen with COVID, but with most vaccines, that's what happened. Is the initial series is just the building blocks for building those T cells and B cells that are responses that are part of your immune system's response. And then the booster shot a few months later actually makes the whole building. So it provides a much bigger response of your immune system, and it generally lasts a lot longer. So again, we don't know if that'll happen with COVID, but what we do know from the data from Israel is that it has dramatically reduced hospitalizations and deaths and disease amongst people who got the booster shot. So whomever they recommend, the FDA and the CDC recommend to get the booster shot, it's not an emergency to go out and run out and get one, but certainly would recommend it. It's something that we're all going to want to get if we're in that whatever category that they're recommending it for. And there's no shortage of vaccine. Now, there's a shortage of vaccinators. So it may be that, your local pharmacy and practices and things may not be able to vaccinate you right in the next couple of days, but it should be that you should be able to get a vaccine booster in the next 2 or 3 weeks. So it's not an emergency to get one, but I think that if you are somebody from whom it is recommended, I definitely recommend it. It is, and it's a normal course of vaccination. Is you get the initial series, 1 or 2 doses, and then you get a booster shot a few months later. But it will be, we believe that the recommendation from the federal government will be right now for people who get the Pfizer vaccine. Now, it could be, Chris, that they say, well, if you get the Moderna vaccine, you could get a Pfizer booster. I don't think so, but that could be, in which case, be fine too. But my guess is mostly Pfizer. Now, people who got Pfizer vaccine last winter in Maine were mostly living in areas close to Portland and Bangor and Lewiston. So most places in rural Maine did not offer Pfizer because of the special refrigeration it required. So that's going to be a little bit awkward because the most disease we have right now is coming from rural Maine. And of course, but the reason is that that's the places where we have the least amount of people who, the most disease we have right now in Maine is coming from rural Maine. And that's because we have the lowest vaccination rates there. But those are people who didn't get the first shot to begin with. So we hope that they'll go get the first shot. But for those people who are living in rural Maine, who got Moderna, I'm hoping the FDA will speak to that, and there'll be recommendations soon, or for J&J, because certainly people who live in rural Maine, where there's a lot more disease right now, they may be at higher risk and may want to get a booster sooner than later. So the people who got Pfizer are generally more urban located. So it's a, we don't know what the FDA is going to say yet. So it's a little bit, I'm kind of speculating here, but it could be a bit awkward having the FDA saying, if you got Pfizer, get a booster, hold off until we get the data on Moderna and J&J if you got Moderna and J&J. And then meanwhile, people who got Moderna and J&J live in rural Maine, which is where we have the highest risk right now, because that's where most of the disease is. But those are because of people that didn't get the vaccine to begin with yet. Right. So it's complicated.
It's complicated.
It's always complicated. I mean,
right. So let me ask you this, when we talk about mRNA vaccines in general, right? We have used this technology before. Have we ever seen boosters be effective with other mRNA vaccines that would kind of indicate to us that this is something that generally people need?
Yeah. So generally speaking, boosters are used in most vaccines. There haven't been mRNA vaccines yet that needed boosters, so we don't know. I mean, these actually are the first mRNA vaccines. I mean, just to clarify that. So that's
okay. I thought
the mRNA technology has been around for a while. The mRNA technology has been around for a while, and it's been researched for years. They've done some clinical trials with some mRNA vaccines for flu, but there hasn't been, and some other, I think Ebola maybe, but there haven't been a licensed or approved mRNA vaccine yet until these two. So
got it. Okay, cool. Yeah. Well, and the way things stand right now, right? FDA had said the only people who need to think about getting a booster at this time are 65 and older and immunocompromised, right?
We don't. Well, so no.
So they didn't say that initially.
So the FDA has this. So the statement from Friday was an advisory committee to FDA.
That's right. Sorry.
And it's not binding. FDA, to my knowledge, has not released a statement yet. I thought that they would by now. I'm just trying to, I'll check
I'll take a look.
My headline
I think you're
news.
Right. I'll take a look, but I think you're right. I don't think they've issued anything.
I don't think, and I think I would have, I get, headline news from you guys on Washington Post and New York Times. I don't see anything on here.
I get Twitter alerts from the FDA because I'm like waiting for something to pop up.
Do you?
Like,
that's a good idea. Twitter alerts. How do you get a Twitter alert?
If you go to their page on Twitter, like if you go to FDA, near where it says the word following, there's a little bell, and you just click that bell, and it lets you. It'll basically, you'll get a push notification like the same way I do, like right here, like mentioned by Amanda Hill, like it's from Twitter. I would get one that says, FDA just tweeted blah 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 blah.
Oh, okay. Oh, okay. Oh, good.
But yeah,
good,
I think you're right. There's nothing here. Yeah, there's nothing here.
Yeah, I don't see. I don't see anything. So
okay.
So I think that yeah. So that was an advisory committee,
right?
And I listened to the last 2 or 3 hours of it, and what was really clear was that the FDA's got some ideas, but I don't know if their statement will be exactly the same as what the advisory committee voted on. I'm just gathering that it may not be. And then the CDC, so the FDA will be announcing something, I think today or tomorrow morning, because the CDC is meeting tomorrow and Thursday, and
they
the
need
CDC,
the FDA stuff, right?
The CDC is rolling it, so the FDA approves or authorizes the vaccine for a broader group, and then the CDC refines it and puts some parameters on it. So they may say, so for instance, the FDA could say, okay, so it's now a booster's authorized for anybody 65 and older, younger with chronic diseases, or who are essential frontline workers. And then the CDC could say something like, okay, here are the diseases, chronic diseases that we think should be prioritized, people with these diseases. And then here, and we think you should prioritize healthcare workers first, that kind of thing. So they put some further refinements on it, but the CDC's already got a meeting scheduled tomorrow and Thursday. So they must know that FDA is going to make a statement today or tomorrow morning. So I think it would be hard for them to meet tomorrow afternoon if the FDA is not got a statement till later today or till tomorrow. So I think we'll hear something very soon, which might mean we can talk again, because it's a little bit hard. I'm sort of speculating, but
no, that's fine.
Hard to know. But I think so. The main thing is it's a very thorough process that the FDA and CDC have, and it includes their advisory groups. And it's an excellent process, but it's a confusing one when all of them are under the microscope, because people don't realize necessarily that last Friday's was just that meeting was just the advisory committee. It wasn't FDA itself. But by Thursday late afternoon, we should have pretty good parameters of who could get a booster shot. Now, starting in August, the FDA did authorize a third dose of an mRNA vaccine, Pfizer or Moderna, for those who are immunocompromised. So right now, you can get that if you are severely or moderately immunocompromised. And the reason why that's not called a booster dose is because if you're severely or moderately immunocompromised, the statistics show that you likely did not mount a sufficient response to the initial series of vaccines, those first 2 doses. So this third dose is simply that. It's just a third dose to try to get your immunity up there. Whereas a booster assumes that you have good immunity from your prior series of vaccines, and now it may be waning and you need a boost up of your immunity. So that's the difference. It's a kind of a technical difference. And for most people, it doesn't really make a difference. But if you are immunocompromised and you got a third shot, then you're going to need a booster shot at some point as well. So, right. But not probably for a few months.
Okay, gotcha. So they might end up getting a total of 4.
Yeah. And that's, yeah.
I didn't get a chance to dive deep into the headline from Johnson & Johnson on offering a second dose of its vaccine. Do you have any knowledge on that and kind of what that means?
Yeah, so they have some data that they're going to be submitting to the FDA. I don't believe they submitted, at least the FDA has not published that data yet. But the Johnson & Johnson has announced that that a booster shot may be in. They have data that shows a booster shot would be good for people who got that vaccine as well. But again, they'll be submitting it to FDA. The FDA advisory committee will be meeting. Then the FDA will come out with a statement and authorization for that booster shot, probably, and then the CDC will make refinements. So we'll go through the same process with Moderna probably and with J&J. So it's, again, usually these processes are are so quiet that they're not confusing, but they're confusing when they've been so much under the microscope and everybody's like, was that FDA or was it the advisory committee, and what happens? And so it's excellent. It's an excellent, thorough, very engaged process, but it is confusing because it is so thorough that people don't realize, oh, it was the FDA or the advisory committee that's talking.
Right. I guess my last question for you, because I did want to kind of follow up with you on this, was the schools. President Biden had or actually Maine Department of Labor had clarified that announcement from President Biden, which I guess was now 2 weeks ago Friday, or a week ago Friday. That basically says, as we speak about public school teachers, it's either you can get the vaccine or you can submit to weekly testing and show a negative result. What's your thought on that as a choice, as opposed to like we have with healthcare workers, a vaccine mandate?
Yeah, the problem with the weekly testing is that you really, to make it very sensitive, you'd have to be testing every day or every other day. So weekly testing, I think it may be better than nothing, but it also may not be better than nothing, because the fact that you're testing weekly and somebody's negative, it may give them a false sense of security. Like I was negative 2 days ago. Well, it doesn't mean they're negative now. And particularly with a lot of COVID, this Delta variant is so prevalent right now that I think a negative test does give people a very false sense of security. The other thing I would say is that it depends on what test they're using. So, if they're using the quick antigen test, it's good because it can be done on site. You can get the results right away, but they're also less sensitive. So you can get false negatives. So I think that while it's it may be better than nothing, but I think the best thing by far is to make sure that all of our teachers and everybody working with our children are vaccinated. That's what protects our children: vaccination and masking.
So
there's no doubt. I mean,
sure, no, yeah, of course, but obviously, there's a lot of opposition to it, and it seemed that the president, or at least the Department of Labor, was providing people with a choice. But it sounds like the testing would need to be more frequent to be most effective in terms of preventing spread.
So
is that what you're saying?
Just looking at the science, you would want to test at least 3 times a week, if not more, because a test only tells you what your status is right then and there. And if it's the rapid antigen test that you could do on site and get the results right away, that's, I'm assuming, what most teachers or schools would use. They're quite good, but they also have a fairly high false negative rate. So you could get a very false sense of security and be positive the next day, or have been positive when you took the test, but it didn't show up as a positive. So I think the most important thing to make sure our kids are as safe as they can be is to make sure that everybody around them at school and everywhere else are vaccinated and they are masking. That's what the science shows. This is not a political statement. It's just what the science is very clear, that if we want to protect our children and keep them as safe as possible, then everybody around them should be vaccinated and masked.
Yeah,
I mean,
I get it. Even with the news from, even with the news from Pfizer, the other day, I get it. It's as we mentioned a couple of minutes ago, still got advisory panels, FDA, CDC advisory panel, CDC, before we, so it might not be till Halloween that potentially gets the EUA.
I think
that age.
Yeah, we're planning on doing school-based vaccine clinics, but it probably won't be till, we're figuring, end of October into November. We'll be ready to do them right away, but it may be a little while.
Gotcha. Dr. Mills, appreciate it. Is there something that you wanted to add about boosters that we didn't cover?
I think that's it, but I think, but anyway.
If something changes, do you mind if I just kind of shoot you a text and we kind of follow up? Heaven forbid,
of course,
they put out a statement at 1 o'clock.
The FDA will. I'm sure they will. I mean, they should be coming out with something. I just got a little quick notice about something else. So
I'll keep my eyes
there will
peeled.
be. Yeah, and I'm around. So it's great to
Okay.
see you, Chris. You take care.
Likewise.
Thank
Thank
you.
you.
Okay,
Bye.
bye-bye.